Member for Cumberland Colchester.
Well, thank you very much, Madam Speaker. And hopefully today we'll now move into reality as opposed to the fantasy land that was painted here by the Minister of Health. You know, when you look at it, this program of Pharmacare that's trying to be introduced is really about preservation of the costly coalition. And we also know that Canadians are not going to be fooled by the foolishness that's been presented here in the House this morning. And we know that the other plan that they have is to clearly extend the date of an election so that they can access their pensions, which really is the worst state of trying to be a politician that one could possibly imagine is being self-serving, when we know that all of us who should be coming to this House should be here for the benefit of Canadians. And we know that that is clearly not the case, Madam Speaker, with the costly coalition and the preservation, which they've made very, very clear throughout Canada, that this is an essential part of the ability to maintain this inept government in power for as long as it has. So that's the first part that Canadians, of course, are well aware of. The other thing that Canadians are well aware of is the state of coverage with respect to Pharmacare. Avec mes collègues de Bloc, c'est...
With the Bloc colleagues, it's quite clear that this is a provincial jurisdiction when it comes to Pharmacare.
0.2% of Canadians are already eligible for some form of prescription drug coverage. And that, of course, is not some funny conservative talking point. That comes from Stats Canada, CIHI, CLHIA, the Conference Board of Canada. So when you look at the numbers, Madam Speaker, it becomes very simple to understand that there is a gap of about 1.1 million Canadians who do struggle with coverage from Pharmacare. And I think it's important, Madam Speaker, to point that out because this is an honest conversation that we are attempting to have here. We also know that the numbers of uninsured have decreased precipitously since, for instance, the Ontario government has gone on and introduced OHIP Plus. It's also interesting that the minister went on and talked a tiny bit about his historic meetings with all the provincial ministers of health, which, Madam Speaker, I have chosen to undertake myself. And when I have done those, what those provincial ministers of health have made clear is not the rubbish that the federal minister has brought forward, but what they have made clear is that they in no way, shape, or form want another large federal program dropped on their heads to fund, in which, as I said in French, is clearly a provincial area of responsibility, which is the delivery of health care, which oddly enough, Madam Speaker, the federal minister of health has pointed out himself that the delivery of health care is a provincial responsibility and not one of the federal government. In spite of the fact that this minister continues to want to intervene with respect to moving things from that provincial authority and responsibility into the federal government. I did have an opportunity to mention a little bit about this bill, and I would like to expand upon that, that what this bill does is it's creating another government agency. Exactly what Canadians would like to have is more bureaucracy, more gatekeeping. It's going to create the Canadian Drug Agency, which will cost about $90 million to create, and perhaps another $30 or $35 million a year. But again, who worries about monetary policy? Certainly not the NDP Liberal coalition, to continue to allow that agency, that new agency, to exist as time goes on. It's odd also, Madam Speaker, that the government has posted on its Canada.ca website a list of drugs, diabetic drugs and contraceptives, which in no way, shape or form may or may not represent what is actually on the formulary in the future, because we know that it will be the responsibility of the Canadian Drug Agency, with consultations with provinces and other stakeholders to then create a formulary which could be used. I think it's also important that if we were to have any faith whatsoever, which quite personally I don't, in the formulary that has been put out thus far, much to the chagrin of Canadians, that it's rife with older medications, and there's no fees there for pharmacists, and there's no fees on that list to look at the primary care which is provided by pharmacists to many, many Canadians with the sad reduction in the number of family physicians. I think it also worth noting very specifically, Madam Speaker, that the blockbuster drug in terms of treatment of diabetes in a generation, namely Ozempic, is not included. No surprise. As I was saying, after the creation of the Canadian Drug Agency and a formulary and these consultations, the only consultations that have happened thus far, of course, are with the NDP Costly Coalition partners, which should not give Canadians any warmness in their heart. When we look at the other issues that are clearly brewing in Canada at the current time, Canadians know that the state of our beloved healthcare system has been under siege by the inept management of the NDP Liberal coalition. We know that wait times have surged beyond what they have ever been in history. For instance, the wait time from seeing a family physician to a specialist to obtaining a specialist-based treatment has increased by 195%, 27 weeks wait time. We know that this is the highest it has been in 3 decades, 30 years. Is this a system that Canadians should be proud of? The other disturbing statistic is that 6.5 million Canadians are without access to primary care. As time will march forward, as it always does, by 2030, in Ontario alone, there will be 2.3 million Ontarians at the current time without access, surging to 4 million Ontarians without access to primary care. Madam Speaker, it's very clear, even if this were a good Pharmacare plan, which it clearly is not, without access to primary care, there's really no way to get your medications. And I would suggest that there is a bit of misguided nature here. I think the other difficulty that Canadians also are very aware of is that the newest medications, a class of medications called biologics, which account for 2% of claims, are now accounting for 30% of spending. Of course, Madam Speaker, none of these biologics are included on any of the proposed Fantasyland formularies by this NDP Liberal coalition. The other problem we have in our healthcare system is wait times from application for approval of medications to be on formulary to the actual acceptance on 50% of public formularies. And we have the longest wait times in the world, 25 months for new life-saving therapies. So in a government that should be seized by policy changes to improve the lack of bureaucratic control and the ability to change things that would be cost-effective for Canadians, and indeed changes like this to make a government work more efficiently would actually not cost the government anything. It would cost Canadians nothing. And what is this government doing? Again, as I said previously, they are interfering with clear provincial jurisdiction and adding federated programs that in no way, shape, or form could possibly reduce the cost for medications. The other reason, of course, Madam Speaker, is that the cost of these medications are already in a forum which allows all of the public plans to come together under a program called the PCPA, which allows all public plans to negotiate for low prices for those medications already. So for the Federal Minister of Health to suggest that this new plan will suddenly allow prices to drop precipitously is absolutely and categorically untrue. Right. The other major issue, of course, is related to finances and cost of living, Madam Speaker. When Canadians were asked what is the major cause of their inability to afford their medications, I suspect my colleagues know very well what the answer to that question is, and the answer is inflation. Yes, Madam Speaker, inflation is cited as the major cause of Canadians' inability to afford their prescription medications. So why do we have 40-year high inflation? Well, of course, it's with the costly coalition of the NDP and Liberals. We know that the chance of a young Canadian now owning their own home is almost zero. It is a dream that is almost dead because of the NDP Liberal coalition incompetence. We also know that more than ever, Canadians are turning to food banks to enable themselves to feed their families. 2 million Canadians a month, sadly, very sadly, are having to go to food banks. And what do we see? We see more large federal government spending in what David Dodge called last evening perhaps the worst budget announcement in the history of this country. And what are we doing today? We're waiting for more of these terrible budget announcements today, in which we will see another $40 billion estimated of deficit spending. On top of that, Madam Speaker, we know that the $1.2 trillion debt that this NDP Liberal coalition has coffered together, of course, more than all governments, Canadian governments combined in history, is costing now more to service that debt than we are spending on health care, which is an incredibly sad state of affairs. And certainly I would suggest that it's one that Canadians are taking very close and paying very close attention to. We also know that simply saving for the down payment on a mortgage is now taking 25 years, when the Canadian dream would be those 25 years would allow us to pay for a mortgage, not to save simply for the down payment. Madam Speaker, Canadians are suffering more and more with their mental health. And we know also that this Liberal government had committed $4.5 billion to the Canada Mental Health Transfer. And Madam Speaker, not one penny of that has been transferred. A very, very sad state of affairs, when 1/4 to 1/3 of all Canadians are currently suffering with mental health issues, and they believe that 50% of them are suffering with inadequate treatment. Madam Speaker, $4.5 billion could go a long way to help treat the mental health care of Canadians. This NDP Liberal coalition has had a multitude of failures, and I think they're worth pointing out simply because of the fact that why would Canadians believe that another large federal program will ever come to fruition? What we know is that these programs are great announcements. I think the next Prime Minister of Canada has spoken about that you can't eat these papers that the announcements are printed on, and they're incredible photo ops for ministers to go out and say that they might be capable of doing things when Canadians know that they are absolutely unable to do so. Sadly, Madam Speaker, I'd asked a question of the Minister of Health, which he once again failed to provide an answer to, but now I'm quite happy to provide that answer, that the Canadian Dental Care Program, last week I had the opportunity to speak to every dental association in this country, save for the Yukon, simply because of time. But that being said, here's a sample of the number of dentists who have signed up for this widely touted program. In my home province of Nova Scotia, 4. Madam Speaker, wow. 4. Not 400, not 14. 4. Wow. 1, 2, 3, 4 dentists out of 400 have signed up for this program. Shameful. In Prince Edward Island, Madam Speaker, it's even easier. 0. There's no debating 0. None. Zilch. Nitch. Zada. Nada. In New Brunswick, once again, to be clear, 4, 1, 2, 3, 4 out of 370 dentists have signed up. The most we were able to find was speaking with the British Columbia Dental Association was 400 out of 4,000. Wow. Still a mere 10% of dentists. This is a program that has been created without any consultation with respect to dentists, and has been creating an incredible administrative burden on dentists, and has also created a conflict where dentists have to sign a contract with a provider, namely the federal government, as opposed to having a relationship with the patient, which is how healthcare has historically and always been delivered in this country. So dentists will continue to ask questions about this program, and certainly why would they sign up for a program when they have distrust of this NDP Liberal coalition. Let's talk a bit about affordable housing, which was another failure which was promised by this government in 2015. They will have to build 9.6 million homes over the next 10 years. And we know also that they are now building less than this country was building 50, not 15, 50 years ago. Less houses being built now because of the terrible policies of the NDP Liberal coalition. We also know that this Prime Minister sat here in this House of Commons and promised 7,500 new doctors, nurses, and nurse practitioners. And as I mentioned previously, 6.5 million Canadians now do not have access to primary care. 6.5 million. And we also know that this government continues to spend money that could be easily used to generate these spots for Canadians on their consultants, of which they are quite happy to line the pockets of their friends. They also said they would reduce Canada's federal debt to GDP ratio every year, which sadly we know has not happened. We know that they can barely even deliver passports, Madam Speaker, which is actually one thing that is in the purview of the federal government, which they're now announcing things that certainly delve into provincial jurisdiction, and they can't do things that they should be able to do, which are simply the purview of the federal government. So as we begin to look at these things, we know that this NDP Liberal coalition is an abject failure. Now, people will often say, you know, you've got a lot of negative things to say. Why don't you give Canadians hope? Well, Madam Speaker, let's focus on that for a few minutes. I'm not sure, Madam Speaker, how much more time I have, so I'll focus on it for a bit. But it's the Blue Seal program, which we have announced here as Canada's Conservatives, which will allow those who have trained internationally to quickly and safely have their credentials recognized here in Canada. And that is a program. Why has that been created? Because as we go around this country, what we hear from new Canadians who have trained in other countries is that now they are driving taxi cabs. Madam Speaker, I heard a story from one trained physician who's not allowed to work in this country, that he was very sad because his young child asked him, "Dad, if you are a physician, why do you go to work dressed as a security guard every day?" Madam Speaker, it doesn't get any worse for new Canadians than that. So as we look at that, we know that Canada's Conservatives have been working hard to create policies when we form the next government that will easily allow new Canadians to have their credentials recognized here in Canada so they can support Canada's healthcare system and work in a manner in which is attuned to the training that they have undertaken in their home country. So, Madam Speaker, what do we have? We have, again, a photo op, we have papers, we have announcements. We do not have a plan that has been put forward by this NDP Liberal coalition in any way, shape, or form. We have more announcements, we have no actions, and we have continued interference in provincial jurisdictional matters, which, as I said, Madam Speaker, as I've gone around the country speaking to provincial ministers of health, the last thing they want is another federal program dropped in the laps of provinces to have to pay for because of the ineptitude of this NDP Liberal coalition. So we await the time when the Conservatives will form the next government of this country. We'll have a new Prime Minister and new hope for Canadians as they are able to afford their lives, and the inflationary pressures and the inflationary spending that continues to be put forth by this NDP Liberal coalition will end, and Canadians can then not be priced out of their lives. Madam Speaker, we will axe the tax, we will build the houses, we will fix the budget, and we will stop the crime. Madam Speaker, I would like to put forward a motion, that the motion be amended by deleting all the words after the word "that" and substituting the following, and I quote, and this is seconded by the member from Edmonton Riverbend: "The House declined to give second reading to Bill C-64, an act respecting pharmacare, since the bill does nothing to address the healthcare crisis and will instead offer Canadians an inferior pharmacare plan that covers less, costs more, and builds up a massive new bureaucracy that Canadians cannot afford." Thank you, Madam Speaker.
Mr. Ellis, seconded by Mr. Genereux, moves the following: that the motion be amended by deleting all the words after the word "that" and substituting the following: the House declined to give second reading to Bill C-64, an act respecting pharmacare, since the bill does nothing to address the health care crisis and will instead offer Canadians an inferior pharmacare plan that covers less, costs more, and builds up a massive new bureaucracy that Canadians can't afford. The amendment is in order. Debate, questions and comments. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Madam Speaker. I think it's really important to look at the contrast between the Government of Canada and the Liberal Party versus what the Conservative Party is espousing. We are the only party that is espousing a national health care system in which Canadians have grown to love for generations now. And what we're talking about is expanding and looking at ways in which we can complement that national health care system by bringing in a Pharmacare program, Madam Speaker, at least a good step forward. That's what we are proposing. The Conservatives, on the other hand, are proposing to kill it. They're proposing that the federal government should not play a role in many aspects of health care. I believe that the Conservative Party is doing a great disservice to Canadians, and my question to the member, quite frankly, is can he give a clear indication as to why the Conservative Party does not believe pharmaceuticals has a role to play in the Canada health care that Canadians want it to play, Madam Speaker? Why not?
For Cumberland Colchester.
Well, Madam Speaker, what this member said is categorically untrue. What we have pointed out with the eloquent speech that I just gave is that 6.5 million Canadians do not have access to health care. We know that the wait times are the longest that they've ever been